So a little bit about who are we. Kidney Cancer Canada was formed only in 2006 by two people. You can see the people that are in front of you. One of them is Deb Maskins, who some of you may have met in the past through Kidney Cancer Canada, and the other one is Tony Clark. And Tony and Deb met at Princess Margaret Hospital in Toronto several years ago when they were both diagnosed and going through treatment, and realized there was not a lot of support or information or pieces of sharing in the community, so they actually formed Kidney Cancer Canada. So it was and still is the first and only charitable, not-for-profit, patient-led support and advocacy organization that focuses totally on kidney cancer. In about 2006, when it started, the two that were on the other page, Deb and Tony, it's now grown to over 2,100 people on our database of patients across the country, which is wonderful news because as a very small organization, it's really difficult to try and reach everybody across the country, and they've done an amazing job. The mission of Kidney Cancer Canada is to help or improve, support the lives of patients and their families that are living with kidney cancer, to provide support, information, and education, raising awareness of the disease itself, raising funds for research, which is paramount of importance to be able to try and find the cause and cure for this disease, and also advocating, teaching patients how to advocate for themselves, how to partner in their health care, but also advocating for access to drugs across the country and for treatments. So behind the scenes, we are lean. There's one full-time staff member and two part-time. So we have one admin that works part-time in Quebec, and then we have another admin that's working in Toronto. We have a working board of directors, and when I say working, I do mean working. They are all volunteers. They're either patients or caregivers or someone that's been touched by kidney cancer, and they do a tremendous amount of work and help. Otherwise, we couldn't do what we do. There are around 80 volunteers, and as we said, we've been able to log about 3,800 hours of volunteer hours, and that was in 2012. We don't have an office, so we work virtually out of our homes. The medical advisory board, there are 19 renal cell carcinoma specialists, very, very well thought of, highly recommended representatives in their field across Canada. They're also involved with Kidney Cancer Canada Nurses Network, which is an extremely important organization because kidney cancer is not, the incidence isn't really high for nurses that work in kidney cancer to be able to collaborate, share best practice, talk to each other about what they're doing and help support each other is extremely important. And then there's the Kidney Cancer Research Network of Canada, which again is a group of kidney cancer specialists that are doing research, keeping up with all of the new and positive treatments that are coming. The objectives, one of the objectives that we have, that you have, a physician has, a nurse has, a caregiver has, is that we're able to get access to all approved treatments in Canada. So anything that's been approved by Health Canada for safety and efficacy, that we can get it funded in every province. And it doesn't matter, it shouldn't matter where you live, it shouldn't matter whether you have private insurance or you have insurance through the government. Everyone needs to have coverage to be able to not have to worry about what they're going to do to get their cancer treatments, but to be able to try and be as well as they can going through this experience. Also, increased awareness and treatment options for kidney cancer treatment and for patients across Canada, because the level of knowledge from one center to another versus the community is very different. So to be able to know that you're getting the best care, again, that's why it's so important that you as a patient or a caregiver are going to advocate on behalf of yourself. The other is improved quality of life so that we can provide as much support as we can, sharing, doing peer support, where if you are newly diagnosed and you want to speak to a newly diagnosed patient, call in and we will connect you with someone to be able to talk about their experience going through what you're going through. And we do find that a lot of times just talking and sharing your story is comfort in itself. And of course, big is increasing funding for kidney cancer research. Kidney Cancer Canada does support the research network every single year with money, but obviously it's something that you never have enough of if you're going to do large research. We do have a very, very good, credible website in French and English. There is an interactive map to be able to communicate. We have discussion forums. The peer support, as I mentioned, is really, really critical for people. And the patient education meetings, just like tonight, we have 6 to 8 regional meetings or smaller evening meetings a year, and then the one large conference. And that should have been changed, is going to be in April in 2015 in Calgary. So that's when the National Patient Conference will be taking place next. There are also educational videos on our website, and I was very impressed with them because it's called Ask the Experts, and you can go online and look at the information that is shared by physicians and learn a tremendous amount about the disease, about treatment options, just to be able to keep up with the information. You know, clinical trials, what are the available clinical trials? Questions to ask your doctor, which sounds like kind of a strange thing to say, but many people don't know what to ask, so they don't ask. So if you do go on and you can find out the questions that you need to ask, it'll certainly help. And then again, the 10 top tips as far as what you're dealing with and being able to go through it with the support of Kidney Cancer Canada. These are some of the publications. I certainly have some at the table, and we do try and do a newsletter. We're behind right now, but it will be coming. And also the brochure on Kidney Cancer Canada, as well as really good support material on kidney cancer. So this is the website. And we are also on Twitter and Facebook, and we do archive our videos on YouTube or on Kidney Cancer Canada website. So this one tonight, for example, will be archived on our website, and then people, you don't need to worry about writing things down as much. You can certainly go online and listen to it when it's up in the next couple of